It's a great day to talk rehab. I'm Dr. DeFabio, and today it's all about lateral epicondylitis, medial epicondylitis. It's about what? Elbow pain. We're going to talk about how to diagnose it, number one, but more importantly, how to figure out if you're going to benefit from an elbow brace and how to apply that elbow brace. So first, let's talk about what the issue is. The issue is for most people is inflammation around the elbow on the outside, this little bone right here. And it is almost, feels like it's bruised. You bang up against it and it hurts. You grab something, it hurts. You reach out and it hurts. This is the common extensor tendon of the muscles that control the wrist elevating. Yes, there's other muscles that attach to it that control rotation too, but it's mostly the muscles that pull up like that. Some of those muscles work when the elbow's straight, some of those muscles work when the elbow's bent. So we have to check both positions. It's a very simple test. With the elbow bent, pull up with the wrist. And you'll see if there's pain in the elbow area or anywhere in the forearm. You also test them straight, pull up with the wrist. We're checking two different groups of muscles, and we're looking for pain in the elbow or in the forearm. You can also do what's called the middle finger sign, where you push up with the middle finger or even the ring finger to see if it creates pain, elbow extended or elbow bent. That differentiation is going to tell you a lot when it comes to your rehab, because if you're having pain with the elbow straight, but you're not having it when it's bent, we know we have to work you close to that point where it's straight but not fully straight. We can exercise you here all day long. It's not necessarily going to help the fibers out here as much as it could, all right? Conversely, if it hurts here, we can't work you here. Maybe we'll work you back here and work into it. So knowing the position where it elicits pain tells you where the primary fibers are involved. So let's say, for the sake of argument, in this position, pull the wrist up. It gives you pain on the outside. How do we know if a tennis elbow wrap is going to work for you? Take something stretchy. This is a neoprene wrap we use in the office all the time, or you can even use some elastic resistance. Neoprene wrap's a little smaller, easier to use because it's got Velcro. I'm going to take it and I'm going to put it 1 inch, one finger breadth below that bump on the elbow. And as I come across the top, I'm going to give it some good authority, a lot of pressure, and then Velcro it down. Then we're going to go to the position where it was painful and pull up again. And if it feels better, guess what? Not only is the wrap going to work, but that's where the position of the wrap is. However, that wrap can go anywhere on the forearm. Sometimes I've had patients wear the wrap as far as down by their wrist, and it gave them relief of the pain up there. So pull up, pain goes away. Not only is a wrap going to help you, you need to wear it down here. So you check, relax, you check that position all the way up about a finger breadth apart, because that position is going to make a huge difference. That's going to be your wrist extensors. Tennis elbow, lateral epicondylitis. Golfer's elbow is when the common flexor tendon to this area gets irritated, all right? These muscles cause flexion. They also cause rotation, palm down, all right? They all attach in through here. So here we need to, let's take this off. Here we need to check, turn palm down. That's going to check what's called your pronator teres, a muscle that runs right in through here that attaches here. And we need to check, bend your wrist. And again, I still check it, even though it's one tendon here, I still check it with the elbow extended and with the elbow bent. Gives me a little bit more information. If you have a painful area and you want to find out if a tennis elbow wrap's going to help you, guess what? Do the same thing. Put an elastic resistance on, cinch it down pretty hard, and repeat the test that was positive that created pain. If there's no pain, the wrap hurts, and that's the position it's going to be in. We could do pronation too. It's usually one or the other. It's usually not both. And then you check all the different positions, just like we did on the outside. So, elbow pain, is a tennis elbow wrap going to work for you? Guess what? Simple things you can do at home on your own. So when you go to your doc, you can tell them exactly your diagnosis. We just love that. The wrap could be a simple stretchy wrap. Doesn't have to be one of those fancy ones. However, if you do get a wrap that's got the extra padding on it, make sure the padding is over the area that needs to be compressed. And that's what this comes in with. It helps you find it, and it really can be something as simple as this. It's time to leave. I'm Dr. Donald DeFabio. Thanks for tuning in. It's been a great day to talk tennis elbow.